Hello there. In today's video, we are going to be exploring the health equity topic. Firstly, we will define and address the concept of health equity and then go ahead to outline ways to improve it. What is health equity? Health equity means ensuring that every person has the opportunity to achieve their best health. Unfortunately, many social and environmental factors can limit a person's access to use of good health practices and health care. Factors outside a person's control, such as discrimination and lack of resources, can prevent them from achieving their best health. These are called health inequities. Working towards health equity is a way to correct or challenge these factors. Examples of these obstacles also include racial and ethnic discrimination, lack of access to quality education, income and wealth gaps, inadequate housing or lack of housing, and unsafe environments. By reducing, challenging, or overcoming these obstacles, people can achieve health equity. However, this is rarely something a person can do for themselves. Instead, it requires adaptive changes from community, healthcare organizations, and governments. Now, let's take a look at the major concepts in health equity. People use many different terms when it comes to accessing healthcare, including health disparity, health equality, and health equity. Let us explore this concept in greater details. Firstly, health disparity. Health disparity is a difference that affects a person's ability to achieve their best health. Examples of health disparity include race, gender, education, income, disability, geographic location, and sexual orientation. These disparities create health inequities. Due to their differences of situation, some people do not always have access to the same opportunity to better their health that other people have. A health disparity is often beyond an individual's control. Moreover, there are two concepts that refer to how to correct these health disparities. These are health equality and health equity. What are the differences between these two terms? Health equality means everyone has the same opportunities. Example could include a community center offering free or low-cost checkups to everyone. Meanwhile, health equity means that people have opportunities based on their needs. An example could be the same health center charging people based on their ability to pay. A person who cannot afford care may receive it for free, while another person may pay for the same care. Consequently, health equality means everyone received the same standard of care, while health equity means everyone received individualized care to bring them to the same level of health. However, health equality is not always preferable. For example, if a clinic offers free checkup every morning, a person who must work during the morning cannot take advantage of this service. Even though the clinic offers checkup to everyone on the same terms, some people still cannot take advantage of the service. On the contrary, health equity will involve offering alternative checkup times in the afternoon or evening, so everyone can access the service at the time that suits them. Now let us look at some examples of health equity. Some examples of services that promote health equity includes providing health seminars and courses that are specific to the needs of certain ethnic communities and racial groups, providing low-cost services to those living in a low-cost household, using mobile health screening to help those who may not have access to transportation, offering evening or late-night health appointments to those who work long hours and are unable to access care, and providing better education, testing, and treatment access to communities particularly impacted by certain conditions or diseases. Therefore, to promote health equity, government and community organizations must acknowledge and attempt to remove barriers to care. Issues surrounding health equity. Groups who do not enjoy health equity are those that are traditionally disenfranchised and discriminated against through no fault of their own. Examples include people living in low-income households, racial and ethnic minorities. Members of these communities are more likely to experience barriers to healthcare, such as violence, low income, and poor living conditions. Gaining health equity takes a combination of political, community, and personal efforts. An individual cannot usually correct all the factors that affect their health equity. However, they can benefit from programs and professionals that assist them. How to promote health equity. Individuals and organizations can take steps to help other individuals achieve health equity. The following are some steps to take. Firstly, identify how health disparities in a community affect specific groups. Recognize that each person has their own racial and ethnic biases, and learn how to recognize when a policy may sometimes unintentionally exclude a person or group. Show respect to people of all groups and make effort to involve all groups in enacting change. Frequently evaluate how well policies aimed at health equity are working, and encourage people to contribute using their own talent, time, and gifts. An example could include tutoring students to help them obtain their high school diploma, or a healthcare professional volunteering their time to help a clinic. It is worthy of note that to promote health equity, a person must work with others to lift healthcare barriers whenever possible. In summary, health equity means ensuring that everyone has the chance to be as healthy as possible. However, factors outside a person's control, such as discrimination and lack of resources, can prevent them from achieving their best health. Therefore, by modeling and promoting health equity, individuals and organizations can improve healthcare for those living with health disparities. Subscribe to this YouTube channel for more on our public health animated lecture series. Please like this video if it was valuable and leave your comments below.